What to do when your child has a bleeding injury. Imagine your child gets a small cut while playing or a deeper wound from a fall. Knowing what to do can make a big difference in helping them recover quickly and safely. When your child has a bleeding injury, your first goal is to control the bleeding while keeping the area clean to prevent infection. Stay calm and carefully look at the wound. If you see an object stuck in the wound, do not try to remove it. Instead, press gently around it and call emergency services immediately. If the bleeding is heavy, spurting, or does not slow down after pressing for 10 to 15 minutes, seek emergency help right away. Before touching the wound, wash your hands thoroughly to prevent infection. Use a clean cloth, sterile gauze, or a towel to press firmly on the bleeding area. Keep applying steady pressure for at least 5 to 10 minutes without checking too often. If blood soaks through, do not remove the cloth. Add another layer on top and continue pressing. Elevating the injured limb above the heart level can also help reduce blood flow and slow bleeding. Once the bleeding slows or stops, gently rinse the wound with clean, cool water to wash away dirt and debris. Avoid using harsh antiseptics like alcohol or hydrogen peroxide directly on the wound because they can irritate tissue and delay healing. Instead, clean the surrounding skin with mild soap and water. After cleaning, apply a thin layer of antibiotic ointment to help prevent infection. Cover the wound with a sterile bandage that keeps it moist but allows some air to reach. For wounds on hands or feet that might get dirty, keep the bandage on during the day and let the wound air out at night. Keep an eye on the wound for signs of infection, such as increasing redness, swelling, warmth, pus, or pain. Also watch for signs of shock in your child, like pale or clammy skin, rapid breathing, weakness, or fainting. If any of these happen, seek emergency care immediately. You should contact your child's healthcare provider or emergency services if the bleeding does not stop after 10 to 15 minutes of applying pressure, if the wound is deep or large, or if there is an object embedded in the wound. Wounds on sensitive areas like the face, eyes, ears, or genitals should be checked by a healthcare professional. Also, if the injury was caused by an animal or human bite, a burn, or a puncture wound, medical attention is necessary. If the wound shows signs of infection or is not healing well, do not delay in seeking help. Encourage your child to rest and keep the injured area elevated to reduce swelling and bleeding. Do not use a tourniquet unless a healthcare professional advises it, as it can cause tissue damage. For bleeding inside the mouth or nosebleeds, leaning forward slightly and pinching the nostrils can help control bleeding. Remember, staying calm, acting quickly, and keeping the wound clean are key steps in managing bleeding injuries at home. Always follow up with a healthcare provider for proper assessment and care.